A Dallas County man who recently traveled out of the country tested positive for monkeypox Monday. It's the first confirmed case in Texas this year. The virus is considered endemic in multiple African countries, and most cases outside of those countries usually come from someone who traveled there. But this year, new cases started coming up in countries that don't normally see outbreaks, mostly in the UK, Spain, and Portugal. There are now more than 1,000 cases worldwide, including about 35 in the U.S., spread over 15 states. And while one of those cases is now someone living in Dallas County Health and Human Services Director Philip Wong says there's little cause for concern.
It's not as easily spread as like COVID, usually through direct contact with infectious sores or scabs or body fluids. You can get it by some respiratory secretions with prolonged face-to-face contact, but it's more with that direct contact, a lot of maybe intimate contact.
It's unclear how the Dallas County patient contracted the virus, and it's unclear if the man has the same strain fueled by the multi-country outbreak. Dallas County health officials identified people who have been in direct contact with this person, and they're also looking for anyone on a recent flight from Mexico to Dallas. Details about the flight weren't immediately available.
It's not like anyone who flew on that flight, from Mexico needs to worry. We're in contact with persons who may have been had close contact with the individual.
Most of the cases from the European outbreak and most of the cases in the U.S. have involved men who have sex with other men. But anyone who had prolonged contact with an infected person is at risk. The CDC says some people got infected because they lived with an infected person.
It's not something that is attributable to contact with an infected animal or travel to an endemic region, but it's something that's spreading through social networks. And because it lacks some of those prior epidemiological characteristics, we may miss cases. Cases may have the opportunity to spread, and that's likely going to cause more cases to be found in the coming days and weeks.
Unlike COVID, it doesn't really spread until people have symptoms, and some of those symptoms are very obvious.
It starts out similarly to sort of non-specific flu-like symptoms. And then, maybe 1 to 3 days after the appearance of the fever, you start to get the rash. The rash starts out as a flat rash, then becomes raised and becomes then sort of fluid-filled and then pus-filled, sacs or, pox type things.
That was Fox's Stephen Dial reporting. The Dallas County man has not been hospitalized and is isolating at home. The CDC is urging travelers to wear masks on flights to keep both monkeypox and COVID at bay.